Hello, everyone. Today, we're going to talk about a health issue that can be surprisingly common and incredibly painful. Kidney stones. Let's break down exactly what they are in simple terms. Your kidneys are amazing organs. Think of them as your body's sophisticated filtration system. They work around the clock, cleaning your blood, removing waste products and excess fluid, which then become urine. Sometimes, certain minerals and salts in your urine can build up and crystallize. When these crystals clump together, they form a hard, pebble-like mass. This mass is what we call a kidney stone. They can be as small as a grain of sand or, in rare cases, as large as a golf ball. These stones don't always stay put. Problems arise when a stone travels. It might move from the kidney into the ureter, the very narrow tube connecting the kidney to the bladder. This journey often triggers the intense pain associated with kidney stones. The stone can block urine flow, causing pressure that sends powerful pain signals to your brain. Imagine a tiny, sharp rock trying to pass through a very small, delicate tube. It's easy to see why it's so painful. There isn't just one type of kidney stone. Knowing the type helps doctors choose prevention and treatment. Calcium oxalate stones are the most common. Oxalate is found in foods like spinach and nuts. Uric acid stones are linked to high animal protein diets and are more common in people with gout. Struvite stones are often linked to chronic UTIs. Cystine stones are rare and caused by a genetic disorder. In short, kidney stones are hard mineral deposits formed inside your kidneys. As we gracefully age, our bodies undergo a multitude of changes, and our kidneys are no exception. One of the primary reasons is a natural decline in kidney function. Over the years, the kidneys can become slightly less efficient at filtering waste, leading to more concentrated urine. Another significant contributor is changes in hydration habits. Many seniors don't feel thirsty as often, age-related thirst impairment, which can cause chronic low-level dehydration. Mobility issues or fear of nighttime trips can lead seniors to limit fluids, concentrating urine, a major risk. The presence of other medical conditions also plays a huge role. High blood pressure, diabetes, obesity. Many seniors manage one or more of these. Some medications, like diuretics for blood pressure, can change urine chemistry. That can promote calcium-based stones. Treatments for one issue can sometimes contribute to another, so medical oversight matters. Finally, diet and metabolic shifts can tip the scales. A lifetime of habits can catch up. Sodium, sugar, and high animal protein intake increase risk. Slower metabolism changes how the body handles these nutrients. Recurrent UTIs, more common in older adults, especially women, can cause struvite stones. These cumulative factors create a unique risk profile for seniors. So awareness and prevention are key. Next, we'll explore symptoms and how they can differ in seniors. When we think of kidney stones, the first thing that usually comes to mind is excruciating pain. For most adults, the classic symptom is sharp, cramping pain in the back and side. It often comes in waves and can radiate to the lower abdomen or groin and cause nausea and vomiting. Other signs include a burning sensation during urination, a persistent need to urinate, urine that looks cloudy, pink, red, or brown, signs of blood or infection. However, in seniors, the presentation can be quite different, often more subtle, which can delay diagnosis. They may have a dull, persistent ache mistaken for a simple backache or GI issues like constipation. Other chronic conditions and medications can mask or alter pain perception. One big difference: non-pain symptoms. Sometimes the first or only sign is a sudden change in mental state, confusion. It can show as agitation or delirium, especially in those with cognitive fragility. An infected or blocking stone can cause inflammation with systemic effects, impacting brain function. A UTI that doesn't respond to antibiotics can be hiding a stone. Caregivers and family must stay vigilant for atypical signs. Other warning signs: unexplained fever, chills, or a big decrease in urine output. These are emergencies. Nausea and vomiting are common. Loss of appetite without flank pain is a red flag. Recognize that a kidney stone in a senior might not look like the textbook case. You need to look at the whole picture, not wait for one classic symptom to appear. Next, we'll look at the newest 2025 research on risk and prevention. As we stand here in 2025, medical research continues to uncover new insights into kidney stone disease, especially focusing on risk factors and prevention strategies for our aging population. One of the most exciting areas is the gut microbiome. Groundbreaking research this year has further solidified the link between gut bacteria and calcium oxalate stones. Scientists have identified strains like Oxalobacter formigenes that help break down dietary oxalate. Many seniors have diminished populations of these bacteria, often due to past antibiotic use. Clinical trials are testing targeted probiotics, branded as K-biotics or kidney biotics, to repopulate oxalate-degrading bacteria. Initial 2025 results are promising. Daily probiotic supplements may reduce urinary oxalate in at-risk individuals. This shifts prevention from restrictive diets toward improving the body's natural oxalate processing. Another 2025 finding: rising global temperatures correlate with increased kidney stone incidence. Experts describe a kidney stone belt in hotter regions, a big concern for seniors prone to dehydration. Public health advisories are adding hydration guidelines tied to local temperature and humidity. Researchers use AI and big data to build personalized risk profiles for kidney stones. These models consider genetics, medications, comorbidities, diet, and local environment to flag at-risk seniors. Clinicians can intervene earlier with targeted counseling or advanced urine testing. This predictive, personalized approach could prevent stones long before they form. It's an exciting time. Now let's look at breakthrough treatments that help seniors when prevention isn't enough. When prevention isn't enough and a kidney stone needs to be treated, the good news is we have incredibly effective and minimally invasive options today. Long gone are the days when open surgery was the only solution. One common advanced treatment is ureteroscopy. A thin, flexible scope with a tiny camera is threaded through the urethra and bladder up into the ureter. No incisions are needed. A laser fiber passed through the scope breaks the stone into dust-like particles that can be passed. For larger kidney stones, percutaneous nephrolithotomy, or PCNL, is commonly used. A very small incision allows a direct tunnel to the kidney and insertion of a nephroscope. Specialized instruments break and suction out fragments. Recent 2025 advances include mini PCNL and ultra mini PCNL. Smaller instruments, less bleeding, faster recovery for older patients. A promising non-invasive technology is burst wave lithotripsy, or BWL. Unlike traditional shock waves, BWL uses short harmonic ultrasound bursts that are gentler on surrounding tissue. It may be done without sedation in a clinic, and trials show it can crumble stones into passable fragments. Think of using a specific sound frequency to shatter a glass. Target the stone, spare the tissue. For smaller stones likely to pass, doctors may prescribe alpha blockers like tamsulosin. These relax ureter muscles, widen the passage, and make it easier and less painful for stones to travel. Medical expulsive therapy can help many patients avoid invasive procedures. Treatment is tailored to the stone, anatomy, and overall health. Minimally invasive options and smarter management equal faster recovery and safer care for seniors. Now, practical steps for seniors and caregivers if you suspect a stone. Suspecting a kidney stone can be frightening. Having a clear plan makes all the difference. The first and most important step is to contact a healthcare provider immediately. Do not try to wait it out. Call your primary care physician or a urologist if you have one. Be prepared to describe all symptoms: back pain, abdominal pain, changes in urination, fever, chills, nausea, or sudden confusion. Your doctor may advise urgent care or the emergency department for immediate evaluation. Severe pain or fever requires immediate attention. At the clinic, the team starts with a physical exam and your medical history. They'll collect urine to check for blood, crystals, and infection. Blood tests assess kidney function and calcium levels. The definitive test is a non-contrast CT scan. Ultrasound is used when avoiding radiation. Imaging guides whether the stone can be passed at home or needs a procedure. If safe, your doctor may recommend over-the-counter pain meds like ibuprofen or naproxen. Always ask first. Drinking water can help flush the stone, but only increase fluids if your doctor gives the green light. More fluid with a complete blockage can increase pain. If sent home, use a urine strainer to catch the stone for analysis. Catching the stone is critical for prevention. Bring any collected stone to your doctor so they can analyze it and tailor prevention. With diagnosis and a clear plan, you can act quickly and confidently. Next, simple lifelong steps to keep kidneys healthy. After a stone, the focus must shift to prevention. The best way to manage kidney stones is to stop them from forming. Hydration. Drink enough fluids to keep urine light yellow or clear. For most seniors, 2 to 3 liters per day. Sip throughout the day, not big gulps. Carry a bottle. If you form a stone, catch it for analysis. This guides prevention. If you form calcium oxalate stones, moderate high oxalate foods like spinach. Also rhubarb, beets, and almonds. Moderation, don't eliminate. Get enough dietary calcium. Yogurt and milk help bind oxalate in the intestines. Reduce sodium, High salt increases calcium excretion. Watch processed foods, canned soups, and frozen dinners. Aim 2,300 milligrams sodium per day. Use herbs and spices to flavor food without adding salt. Add lemon or lime to water. Citrate helps inhibit calcium stones. If you form uric acid stones, limit red meat and shellfish. Maintain healthy weight with balanced diet and gentle exercise. Walking and swimming are great low-impact options. These proactive steps help keep your kidneys functioning beautifully for years to come. Summary: hydrate, moderate high oxalate foods, get dietary calcium, reduce sodium, consider citrate, stay active, and work with your clinician. If you're worried, contact your healthcare provider.